Aqueous deficiency is a different problem from evaporative dry eye. Aqueous deficiency is really about inadequate tear production. Patients often ask me whether they have aqueous or evaporative dry eye, but the reality is many times they overlap. In a dry climate like I'm in here in Colorado, a combination of both is really common. So let's take a step back here and look at what the aqueous tears really do. They provide hydration to the surface of the eye. They deliver nutrients. They protect the ocular surface. And what happens to cause aqueous deficiency? We have lacrimal glands which produce our tears, and sometimes they don't work as they should. And essentially, when we're not producing enough tears, our tear film becomes too concentrated. It really becomes too salty, and the medical term for this is hyperosmolar. This damages the surface of the eye. There is also a mucinous layer, and this is made by the conjunctiva. The conjunctiva is the fleshy tissue that covers the white part of the eye. And the conjunctiva has these goblet cells that produce the mucin layer of our tear film. So often we think of aqueous deficiency as mostly a water layer problem, but I also group the mucin layer with this because they commonly go hand in hand. We can see staining of the cornea, which essentially are dry spots on the cornea, but also the conjunctiva. And treatments for these are fairly similar. They have common symptoms: dryness, grittiness, burning, blurry vision. But one of the things that I see most commonly in aqueous deficient dry eye is light sensitivity, which we tend not to see quite as much in meibomian gland dysfunction. And so you might be wondering why artificial tears are not enough. You would think if you don't have enough tears on the surface of the eye, you can just replace them. But the problem with artificial tears is that they typically have a really short duration. Often they don't last more than about 10 or 15 minutes. But even more importantly than that, our tears are complex. They contain salts, proteins, growth factors, and artificial tears don't contain any of those important things like our real tears do. So how is aqueous deficiency diagnosed? The ocular surface, we can typically see staining of the cornea on the conjunctiva when we put dyes in the eye like fluorescein. And often we see systemic contributions to these issues, such as autoimmune diseases like Sjogren's or rheumatoid arthritis. It's also a combination of things. Most commonly, medications can have side effects that lead to dryness. I would say the most common medications with drying side effects are antidepressants or anti-anxiety medications or stimulants. But I don't think that patients should stop these medications because their eyes are dry, because the reality is that stress and anxiety can also decrease our tear production. This is why treatment must be targeted. We know that controlling inflammation can increase tear production, and we also have a lot of medications these days that can increase tear production, such as Tyrvaya or Tripteer. And we also need to address the systemic factors. If your eyes don't make enough tears, artificial tears alone are really not going to solve the problem. This is why identifying aqueous deficiency dry eye matters, and understanding the role of tear film in maintaining a healthy ocular surface, and why the right diagnosis always comes first.